Now, President Cyril Ramaphosa, as you heard, will address the nation tonight at 8 o'clock. The address comes after the president met with the National Coronavirus Command Council. That's as the Delta variant, first discovered in India, threatens to sweep the country. Some experts, on the other hand, are calling for tougher restrictions. Talking to us ahead of the president's address is health expert Dr Fundile Nyati. Thank you very much, Doc, for your time here on eNCA. Now, first of all, we do know that this is a huge problem, but also I think my first question would be, are South Africans right? Those South Africans who are saying that government was complacent in terms of making sure that the ports of entry from India back in April, May was shut down?
Well, it is easy to criticize. But, a lot of people, yes, when we first heard about this Delta variant in India, they were like, okay, why don't we stop travel from India? But we actually don't have any direct travel, or airlines that are coming from India to South Africa. So that means then one must look at all the airlines, that are coming to South Africa via Europe or even the Middle East. So in terms of practical implementation, that was a problem. And what the authorities said was, when we do pick up one case, then let's do tracing of the people around that particular case. So, but it's really not foolproof, because even countries, in North Europe, North America, who have tried to do the same, have not really managed to do that. So it is much easier said than done.
All right. So now that the president needs to speak tonight, we know that the NCCC was actually supposed to meet on Tuesday, but that was obviously taken back to yesterday. It was on an urgent basis. And then immediately after that, the acting health minister saying this variant is what's causing havoc in the country. So what should the president say tonight? What would you advise that he says tonight?
I think if we really look seriously at this thing, there are certain things that the government can still do, but the bulk of what needs to be done needs to be taken by us as individuals. All right? There is a doctor yesterday who said, actually, each one of us should be a president of his, life or family, meaning we must put ourselves on lockdown level 5 as individuals. But anyway, as far as the president is concerned, I think there are a few things that they can still do. One, I think the banning of alcohol, so that they can reduce, the load of trauma-related stuff in the hospitals to create space. Number two, I think the other thing that can be done is that gatherings should just be banned. Unless it's absolutely necessary. The curfew can be also, extended. But beyond that, we can't really close the economy because we are already in trouble. So, it's going to be a very difficult one, balancing the lives and the livelihoods. So those are just a few of the levers that I think the government has. But I think the bigger responsibility is on each one of us to actually behave as if we were in level 5. Go out only if, you have to. But what we've been seeing is that people are actually, going as if it's business as usual, and gatherings like what we saw outside of SAPRA on Friday should not be happening. 2,000 people in one place. I mean, we're going to see some trouble coming out of that, kind of gathering. So I think also political leaders, church leaders, and other prominent people in society must act responsibly in the interest of all of us.
I think many South Africans would perhaps agree with you, Doc, in terms of those restrictions that you are expecting the president to announce this evening. But for how long? I think a lot of people would ask, how long would you suggest this? Maybe a 2-week, 21 days, maybe, because apparently the peak is actually going to start going down in mid-July.
Well, we do not really know, we don't really know. And me and you, we are in Gauteng, which is now the epicenter of this third wave. And according to the announcements by the experts yesterday, the data that was shown was largely, KZN data, where this Delta virus is the main driver now, almost like 80-90%. Now, the data for Gauteng, to look at the proportion of this Delta virus as far as the Gauteng, numbers are concerned, will be released possibly later this week. Now, depending on that, we will then be maybe in a slightly better, position, I think, as a country to have a sense. In the UK, where this thing came in the middle of April, now it's 2 months later, they are still in the middle of the third wave that is driven by this Delta wave. So it could be a month or even two before that happens, which is why, issues around closing economic activity have to be balanced very carefully, because we don't really know. It's like, how long is a piece of string? So it's very, very difficult, but something needs to be done jointly by us as citizens, and, the government can only do so much.
All right, Doctor, I know that SAHPRA would probably be the correct organization to ask about this, but we all remember what happened last year when we received the AstraZeneca from India. Then we discovered in December that we have this variant that was discovered here, and suddenly efficacy was a problem, and we had to send that vaccine back. Are we possibly looking at the same problem now with this Delta one in terms of the vaccines that we do have rolling out?
Well, I think there is some good news there. Well, bad news and good news. I think I still think the decision by the government in February was the right one, because if the vaccine was about 20% effective against mild infections for the variant, the Beta variant of South Africa, then I think the decision made a lot of sense, although we didn't know in terms of severe infections and deaths. We could only extrapolate. So I think, they were right. However, when it comes to this Delta virus, which is the same one that's driving the third wave in the UK, studies that have been done in the UK have actually been very good, that the AstraZeneca vaccine is actually quite effective in preventing infections and even hospitalizations and death. And so that's the kind of question I actually asked yesterday during the briefing, to say, does that mean now South Africa can relook its decision against the AZ vaccine? And the answer was, well, they will look at the data. As a country, the decision is to have a diversity of vaccines. And by the way, the AstraZeneca vaccine was already approved in South Africa. So it is something that I think they would need to consider, because scientific evidence coming out of the UK is actually showing that the AstraZeneca vaccine is actually quite effective together with the Pfizer vaccine. Although their efficacy, it's slightly lower than, the variant that was circulating there called the Alpha variant.